Hi, this is video update number 4. This is the second part of the Q&A kind of question and answer thing. I asked people what's the questions they wanted me to answer, and thank you for all your great questions. My friend Jacinta, friend and mentor Jacinta, sent me lots of very big, deep questions, so I'm going to do a whole video just on that later on. But for now, I'm going to continue the questions. I'm actually going to continue a question I started answering in a previous video from Angela, do's and don'ts about having cancer. The basic do for cancer or any other crisis, it's a 3-step system that will get you through any problem on Earth, and it's disgusting that we don't teach this to children, really. Getting a bit upset now, but okay, the 3 steps are: number 1, don't worry alone. This means you tell people what's going on to the best of your ability. If you're not someone who can tell people what's going on, then you trick yourself into pretending you're one of those people. Okay? Don't worry alone. Tell some people. It makes it much better. Choose people carefully who you tell. Try and tell the most helpful people first. Tell them if you'd like them to tell other people, because that helps a lot as well. It's very, very tiring to explain to people who either don't know your situation or only know a little bit of your situation when they, message you or talk to you or whatever, and, they're asking about your plans for the summer holiday, and you have to say, well, I just found out I've got cancer, so all plans are off. Step number 2, get the right information. This is so important. Okay, you ask your doctors, your oncologist, which is a cancer specialist, the surgeons. You have to be careful with the surgeons and aggressively ask lots and lots and lots of questions. What are the alternatives to this surgery? What is the purpose of the surgery? Is it to cure the cancer? Is it to slow it down? Is it exploratory surgery to find out, other stuff that's going on inside? You need to be asking those questions. In the UK, we are very lucky to have so many wonderful cancer charities that have really informative websites and booklets and books they can give you. Call up the cancer charities, ask them what questions to ask the doctors, because it makes a huge difference. Step number 3 is make a plan. If you're someone who doesn't make plans, you have to trick yourself into pretending you're someone who makes a plan. You have to say to yourself, if there was someone else telling me I had to make a plan, what would my plan be? Because planning has been proven beyond anything else to affect the outcomes of any situation, even bad plans, even plans that have to be changed immediately. Just the action of making a plan will help you see if you've got the right information or not. The action of making a plan might calm you down. So those are the 3 steps. They should be taught to all children everywhere. It is pathetic that we don't teach that to kids. If I just think, if I had learned that system as a kid, so much heartbreak and suffering would have been spared me. Now, a big don't. Do not fall for so-called alternative cures, okay? There's one way to cure cancer, basically, which is surgery. It's not very nice. When you do surgery, you take what's called for cancer, you take what's called a margin, which means they take out the cancer and a bit around it, so they're damaging healthy tissue. There's my daughter just appearing in the background, Jessica. Yeah. Hello, Jessica. Yeah. My son Edward's just going to come and say hello as well. So Edward, say a message for all the people out there in the internet land.
Hello, please look after Daddy, and the 3 steps are so bad that no children except me know them.
Okay, Edward, you take Jessica and go and play in the T7 room, please. Okay, so those are my kids. Edward's going to very quietly close the door. And so a big don't is don't fall for alternative cures, because there are none. cancer is cured basically by surgery. In some early cancers, it can be cured by chemotherapy or radiation. In some early cancers, or in some situations where surgery can't be used because of the condition of the patient, there are non-surgical methods. So they are very, very specific to your situation, but you might be lucky, or well, lucky or unlucky depending on how you look at it. But with liver cancer, for example, there's ways of almost kind of doing the surgery but using highly pinpointed radiation. That's different from like radiation therapy. It's usually called gamma knife or cyber knife. They have like 95 different rays of concentrated radio energy going into your liver and trying to destroy the tumour. Only can be used if there's like just one small tumour basically, and particularly if the cancer hasn't spread somewhere else. But cancer is cured by surgery. Cancer is slowed down by chemotherapy. In some cases, cancer can be shrunk by chemotherapy. Radiation treatment works for some things as well. They are all unpleasant, obviously. Very, very unpleasant. But they work. They're proven to work. The real proof, beyond anything else, the real proof is that life expectancy for people with cancer who are receiving these treatments has been going up year on year on year as these treatments improve. These treatments basically improve every 12, well, they're improving all the time, but not for patients. They're improving in testing, and basically every year or whatever, a country, or most countries, will publish new guidelines of how to treat cancer. So these are called the protocols. That's why cancer research is so important. A lot of research is obviously funded by drug companies. You can say it's a bit suspect. What I think is suspect is the direction of the research, because they're always trying to. They're obviously going to focus on medicines that people are going to be taking for a long time. So these are effective, but a long time. And that's a shame, because there might be some very effective treatments that are quite short. I'm in fact having one of them. I'm having 2 experimental treatments. Now these are not alternative treatments, these are experimental treatments. There's clinical evidence in labs that they work. Not anecdotal evidence, clinical evidence, as in they get some cancer out of people, put it in test tubes, and animal testing as well, sadly. And this stuff works. So I'm having 2 treatments, one which is very, very expensive and complex, called immunotherapy. I'm having my first immunotherapy session on Friday. 2 weeks ago they took some of my blood, and they're using my own blood to make a customized cancer treatment for me. In fact, they're going to try and make 2. One is the immunotherapy called autologous, which just means your own body, autologous immune enhancement therapy, AIET, which is a very complex thing. So they take out the blood, 2 weeks of playing around with it in a lab, making the white blood cells stronger to then put back in your body as a drip. So I'm going to go on Friday and just spend 30 minutes. I'll be sat on a bed, lying on a bed for 30 minutes, and they put this drip in of my own white blood cells going back into my body, and they will hopefully have effectively programmed them to attack the cancer. And then they're also going to try and make another type of immunotherapy for me, which is a vaccine, like a cancer vaccine. That's what the fundraising is for. So thank you for the donations. It makes a massive difference. Please tell people you donated, because that turns one donation into 2, 3, 4, even more, and makes me feel very good as well. So that's a very complex, expensive treatment. In English pounds, it's basically about £15,000 for a cycle of 6 treatments, or might even work out a bit more, because there's some setup cost for each thing, and it's hard to predict the cost, because they basically do as much as they can in the lab, so they don't really know the cost until they do it. And I mean, they're putting a lot of work. They're not asking money for nothing. I'm having another treatment, which is a very, very, very simple treatment and very, very cheap treatment. It has some clinical evidence. Well, it has evidence that it's worked for people who haven't had any other treatment. The reason it's hard to prove these kind of treatments is that usually you would have them with something like chemotherapy. It's very hard to say if there is a positive effect, was it from this treatment or was it from the chemotherapy? So I'm having a treatment called hypothermia, called localized hypothermia therapy, where they use radio waves to heat up the areas of the body with a cancer. So for me, it's targeted at the abdomen where my cancer mainly is. And it's cheap, it's easy to do, but there's no motivation for a drug company to do a massive trial. Even the companies that make the machines, it's not an expensive machine. It's a simple treatment. You go in, they put some gel on your body, like for me on the abdomen where the radio waves are going to be put in, and you lie there for 40 minutes. It's very boring because you can't, well, they say you can use your iPod, but or MP3 player or whatever, but they say it might get destroyed by the radio frequency stuff. I might try it with like a very long pair of headphones, so it could be on the other side of the room, but possibly the headphone wire would just act as an antenna and it would make it even worse. I don't really want to risk my iPod because it's been a big lifeline to me at the moment. So that's a very simple treatment that you'd think would be available for everyone. It's a treatment that seems to help people who are having chemotherapy because the heat in your body induced by this machine damages the cancer cells. Also, if you have a large tumour, it's very difficult for the chemotherapy to get into the centre of the tumour because the blood supply is bad. But if you heat up the cells 24 hours or within 24 hours of the chemotherapy, then it can really help a lot. I'm going to finish up this video now and do another one in a few minutes.